Spinal TB is a serious but treatable condition that many people don't fully understand. Hi, I'm Dr. Setiobudi. I'm an orthopedic and a spine surgeon at Mount Elizabeth Hospital, Singapore. After last video about spinal TB, we received many great questions. And today, I'll be answering some of the questions. For those of you who have not seen the last video, you can check it out in the link below. And if you find this video helpful, don't forget to subscribe.
Is spinal TB contagious?
Good question. Actually, TB itself is contagious. It is airborne. So most of the time we know TB is pulmonary TB from the lung. When a person suffers from pulmonary TB and they cough, they can spread. But if it is in the spine or elsewhere in the body, non-pulmonary TB, it is a bit difficult to spread because you cannot cough up the spine TB and to spread airborne. So it is not likely, provided the patient has no pulmonary TB.
Can TB affect other parts of the body besides the spine?
Yes, of course. In fact, the most commonly affected organ is the lung, pulmonary TB. But TB can also occur in other parts of the body, not just in the spine. Sometimes it occurs in the brain, in the intestine, or in other bones and joints. It can affect the internal organ as well, like kidney or spleen or liver. The TB bacteria can live in those organs too.
Can spinal TB cause paralysis?
Yes, of course. If the spinal TB causes nerve compression, spinal cord compression, it can cause paralysis. So it destroy or pressing the spinal cord from the TB itself. Sometimes it form abscess, pressing the spinal cord. Sometimes the TB destroy the spine and make it deform, become hunchback. And if the hunchback is too much, sometimes it can poke into the spinal cord and it can cause paralysis. Another thing is instability. So TB destroy the spine, causes instability. The instability between the vertebrae segment can also damage the spinal cord and cause paralysis.
When is surgery necessary and when can treatment be done non-surgically for spinal TB?
Okay, good question. In fact, most of spinal TB can be treated without surgery, conservative. So the treatment is medication, antibiotic, chemotherapy for TB. But there are some instances where operation is advisable or mandatory. When there is spinal cord compression causing paralysis, when there is intractable pain from instability or from hunchback, and when there is progressive neurological deterioration, that one surgery is strongly advisable to save the spinal cord.
Someone asks, I'm done with surgery but still can't walk. When can I walk properly again?
Actually, it depends. If the spinal cord is already damaged, sometimes you may not be able to walk immediately. And normally, surgery doesn't repair the damage, but to free up the spinal cord compression so that the body can recover or repair the damage by itself. So surgery doesn't repair nerve damage, only free up the nerve. If the body cannot repair, the paralysis may be permanent or the weakness may be permanent and the patient may not be able to walk. Okay. But if you leave it alone without surgery, almost 100% guarantee that this will not improve. With surgery for spinal cord compression, it gives hope for those who have spinal cord compression from TB to be able to walk again. But of course, there is no guarantee. It depends on how bad the spinal cord has been damaged. So it is important to treat spinal cord compression early when the symptoms is still not too bad. Don't wait until you cannot walk, paralyzed, then go and get surgery. The chance of walking again is very low.
How long do I need to take TB medication for spinal TB?
Actually, the medication treatment for TB is not done by spine surgeon, but done by infectious disease specialist. Typically, it is given for the period of 9 months. But it is best to hear and follow the instruction from infectious disease specialist.
How long does nerve recovery take after spinal TB?
The recovery is variable actually. It depends on how long the spinal cord has been compressed, how extensive is the damage, and the age of the patient. So for example, the older people have lower repair capability. If the spinal cord has been compressed for so long, the chance of getting better also lower. And if the spinal cord has been damaged, complete loss of nerve function, the chance of recovery is very little. So again, when there is neurological deterioration, weakness, numbness, don't ignore it. If you have spinal TB, got nerve compression, spinal cord compression, it is best to get it treated surgically early.
Can a vertebra damaged by spinal TB regenerate after treatment?
Actually, it can regenerate to some extent, but normally it doesn't fully regenerate to normal state. So infection can heal, the bone can fuse, the segment that is not stable can become more stable. Sometimes TB give you hunchback posture, and usually this one don't recover. Hunchback will remain hunchback unless it is treated surgically.
Can spinal TB come back after treatment?
Good question. If it is treated properly, full course, follow the instruction well, the chance of it is coming back is very low. Of course it can, but not common. But sometimes patients feel better. They still undergo treatment. The recommendation, for example, certain months, 9 months, for example. Before 9 months, they stop it themselves, or they don't take the full medications. Not just one medication, but sometimes can be many. They just take partial, and this is no good. Sometimes TB bacteria is also resistant to antibiotic treatment. So this is very difficult to treat, and of course, the chance of relapse is higher.
Is pregnancy safe after treatment for spinal TB?
Yes, if the TB is treated properly, is in remission, not active, the spine is stable, actually it is safe to get pregnant if you have previous TB, but not inactive TB. If a person have active TB, it is best to be treated first. If the patient has deformity, spinal deformity from TB, pregnancy may exacerbate the back pain. If they have spinal instrumentation from TB, is it safe to get pregnant? The answer is most of the time, yes, it is safe. No problem. There is some stiffness, but it is safe to get pregnant and safe for delivery. Okay, those are common questions asked about spinal TB. And I have tried my best to answer, and I hope this answer can help you. If you have any questions or any comments about spinal TB or other thing, you can write it down in the comments below. Thank you for watching. Don't forget to subscribe, like, and share it to your friends. And see you again in the next video. Bye-bye.